Today, we are going to demystify a medication that honestly, you might have in your medicine cabinet right now, Fluticasone. So if you use an inhaler for asthma or maybe a nasal spray for allergies, you're definitely going to want to stick around because we're about to clear up the single biggest point of confusion about how this stuff actually works. So has a doctor ever handed you an inhaler and said something like, okay, just remember, this one isn't for when you actually can't breathe? I mean, it sounds totally backwards, right? But believe it or not, that one instruction is the key to everything, and we're about to break down exactly why that is. And that brings us to the most important concept we're going to cover today. Seriously, if you take away just one thing, please make it this. Fluticasone is a controller, not a rescuer. Getting this distinction right isn't just helpful, it's absolutely critical for your health. Here's a good way to think about it. Imagine the inflammation in your airways is like a slow-burning fire, always smoldering in the background. A rescuer inhaler? That's your fire extinguisher. You grab it to put out a sudden, scary flare-up. But Fluticasone, well, Fluticasone is the fire prevention system. Its job is to work quietly, day in and day out, to make sure that fire never even gets a chance to start. It works slowly, but surely, to calm everything down. Let's just put these two roles side by side so it's crystal clear. Your controller, Fluticasone, is all about prevention. It's a long-term game plan that works slowly and demands you be consistent. Your rescuer, like albuterol, is the polar opposite. It's for an emergency, an acute attack. It works in minutes, and you only use it when you absolutely need it. You know, it's kind of like a marathon runner versus a sprinter. They're both athletes, but they are built for completely different races. So how does this controller medication actually do its job? I mean, how does it prevent that fire from starting in the first place? Well, it works at a cellular level in a really fascinating way. Let's call it the inflammation dimmer switch. But first, a super quick definition. Fluticasone is a type of drug called a corticosteroid. You've probably heard that term thrown around. All you really need to know is that a corticosteroid's main job is to tell your body to dial down inflammation. Think of it as a very, very powerful messenger. Okay, so when you use your inhaler or your spray, the little fluticasone molecules go on a mission. They travel to the cells in your lungs or your nose, they slip right through the cell wall, and they find a specific partner waiting for them inside called a receptor. Together, this new power couple heads straight for the cell's command center, the nucleus, and that's where your DNA lives. So once it's inside the nucleus, this fluticasone receptor team gets right to work. It basically acts like a supervisor, walking up to your DNA and issuing new commands. It finds the genes that are responsible for making all those inflammatory chemicals and tells them, hey, power down. And at the same time, it tells other genes to ramp up the production of anti-inflammatory proteins. It is literally flipping switches at the genetic level to calm your system down. Pretty cool, right? Now, because fluticasone is so good at targeting inflammation in a specific spot, it's been designed in a few different forms, to be the right tool for the right job, depending on where that inflammation is happening in your body. The delivery method is perfectly tailored to the problem. If you've got inflammation in your nose from allergies, you're going to use a nasal spray. For those deeper issues down in your lungs, like asthma, you'll use an oral inhaler. And for skin conditions like eczema, yep, there's a topical cream. The goal is always the same. Get the medicine directly to the site of the problem. That way, you minimize side effects everywhere else. You might also see a second name on your prescription box, like propionate or furoate. What's that about? Well, fluticasone propionate is kind of the classic version, the one you'll see most often. The newer one, furoate, is designed to last a little bit longer in your system, which is why it's often just a once-a-day dose. They both work the same basic way, just with slightly different timing. Okay, so we know what it is and how it works. But with any powerful medication, it is just as important to know how to use it safely. So let's talk about potential side effects and, more importantly, how you can manage them. The great news here is that side effects generally fall into two buckets. The most common ones are local, which just means they happen right where you use the medication. The much, much rarer ones are systemic, which can affect your whole body. But, and this is a big but, these are typically only a concern with very high doses over a really long period of time. So what do these common local side effects actually look like? Well, for the nasal spray, you might get a little dryness or even a minor nosebleed. For the inhaler, maybe your voice gets a bit hoarse or you have a scratchy throat. And for the cream, you guessed it, a little irritation right where you apply it. For the most part, these are usually pretty mild and manageable. But let's zoom in on one of those side effects for inhalers because it's really common, but also so preventable, and that's oral thrush. So what is it? And more importantly, how do you make sure it never happens to you? Oral thrush is basically just a minor fungal infection. See, the steroid can kind of suppress the immune response right there in your mouth, which lets this fungus grow. But here is the crucial tip. The number 1 way to prevent it is to just rinse your mouth with water and then spit it out every single time you use your inhaler. That's it. It just washes away any leftover medication. Using a spacer device with your inhaler also really helps get more of the medicine into your lungs and less of it sitting in your mouth. Now, for those rare systemic warnings, it's important to know they exist, but it's also really important to put them in context. With long-term, high-dose use, yeah, there can be risks like reduced bone density or a slight increase in infections. For kids, growth is often monitored, but the key thing to understand is that doctors always weigh these small risks against the very large and proven benefits of controlling a serious chronic disease like asthma. Okay, we've covered a lot of ground. So let's boil all of this down to the absolute essentials. If you're using fluticasone, think of these as your golden rules for success. Rule number 1, be consistent. You have to use this every single day, even when you're feeling great. That's the only way it can build up its protective effect. Rule number 2, technique is everything. Seriously, ask your pharmacist to show you exactly how to use your device properly, because if the medicine doesn't get to your lungs, it can't work. And rule number 3, the most important rule of all, never, ever, ever use this for an emergency. That is what your separate rescuer inhaler is for. And that really is the bottom line, isn't it? Fluticasone is a fantastic medication when it's used correctly. By simply remembering that it's a controller, not a rescuer, you are taking charge of your own treatment. Because understanding how your medication works is the first and most powerful step you can possibly take to control your condition.